It's 3 a.m. in the dark corners of Silicon Valley. The screen in front of Emily Reyes blinks steadily. Lines of code cascade like a waterfall, each stroke a whisper in the vast digital ocean. The hum of her computer is the only sound in her quiet apartment. But tonight, everything is different. This is no longer a simple hack to bypass firewalls or crack encrypted systems. She's on the edge of something much more dangerous. Outside, the world sleeps, unaware that one click could bring down an empire worth billions. Her pulse races as the screen flashes with a series of encrypted files. Inside them, she uncovers the first clue. It's a report buried deep in the heart of a pharmaceutical giant's secure system. And it's about something far darker than just corporate greed. It's about illegal drug testing, human lives sacrificed for profit. Her fingers hover over the keys. She feels the weight of the decision pressing on her chest. The lives of innocent people are at risk, but revealing this could cost her everything: her career, her freedom, even her life. A wave of adrenaline surges through her as she decrypts the next file. What she reads makes her stomach turn. Dozens of trials, spanning years, on patients who never gave consent. Drugs tested on the most vulnerable, all covered up with falsified data. And the worst part, the company's executives know. They're complicit, but Emily doesn't know who else is watching. She doesn't know if someone, somewhere, is already aware that the truth is about to come to light. With a trembling hand, she copies the files. The mission to expose Big Pharma's darkest secret has begun, but with every keystroke, the danger increases. Every second that passes, she feels like someone is closing in. Will the truth ever be revealed? And who will pay the price for it? Emily Reyes wasn't always a hacker. She grew up in a small suburban town where life felt like it moved slowly, everyone knowing everyone else. As a child, she was curious about everything, always asking why, always exploring, poking around in places others didn't think to. But that curiosity wasn't always welcomed. Her parents, hard-working and modest, didn't understand her interest in technology. "Girls like you don't need to worry about computers," her father would say. "Go outside, play, leave that stuff to the boys." Emily, however, was never the type to back down. By the time she was 14, she was teaching herself programming languages, taking apart old computers she found in dumpsters and rebuilding them just to understand how they worked. At 19, Emily won a scholarship to a prestigious tech university where she excelled in cybersecurity. But while she thrived academically, she struggled socially. Being one of the few women in her field, Emily faced constant discrimination, her abilities frequently underestimated. Still, she pressed on, determined to prove herself. After graduation, Emily was hired by a small cybersecurity firm. It wasn't glamorous work, patching security holes for small businesses, setting up firewalls, and sometimes cleaning up after data breaches. But it paid the bills. It wasn't until she was recruited by a larger, more secretive organization that things began to change. That organization, with its sleek offices and corporate sophistication, seemed like a dream job. They offered her a high salary, the prestige of working on elite projects, and the opportunity to test her skills in real-world hacking. But behind the polished facade, Emily started to notice something off. The company was obsessed with monitoring and controlling information that shouldn't have been theirs to control. One night, while performing routine security maintenance on a new client server, Emily stumbled upon a series of unusual files. They weren't part of the company's normal operations, but she couldn't resist. She opened them, and that's when she saw it: pharmaceutical test results that had been doctored, lies, massive cover-ups, human lives sacrificed for the sake of profit. The hacker in Emily stirred, but at first she resisted. These files were a temptation, an invitation into a world that could ruin her. But as the days passed, the temptation grew, and so did her moral outrage. The company she worked for wasn't just another tech giant. It was tied to one of the biggest pharmaceutical companies in the world, and what it was doing, conducting illegal drug trials on vulnerable populations, was more monstrous than anything she had ever imagined. At first, Emily thought she could just walk away, but every night, the images of the patients in those reports haunted her. People who were experimented on without their consent. People who had suffered, died, or been destroyed for the sake of a drug company's greed. It wasn't long before Emily realized she couldn't stay silent. She had to expose the truth. It was no longer just a matter of hacking for the thrill or the money. It was a moral crusade, one that could cost her everything. She decided to take action, slowly at first, gathering as much information as she could. But once she accessed the full extent of the data, there was no turning back. She knew that if she leaked the files, it would change everything. The world would know what the pharmaceutical industry had been hiding, and people would be held accountable. Emily's heart pounded in her chest as she made her first move. She emailed the files to an anonymous news outlet known for exposing corporate corruption. But there was no instant relief, no moment of triumph. Instead, the weight of her actions sank in. The files had left her system. But what if they were intercepted? What if the company's security team caught on before she could make it out? For days, she lay low. Her job at the cybersecurity firm became a blur, and her mind was consumed with the knowledge of what she'd done. Her fingers itched to check her email, to see if the story had broken, but she resisted. The last thing she wanted was to be the one caught in the crossfire. Then, one morning, she woke to a text message from an unfamiliar number. "We know what you did." The blood drained from Emily's face. Her worst fear had come true. They had found out. Her phone buzzed again, this time with a voicemail. She played it. The sound of a deep, gravelly voice filled her ears. "Miss Reyes, we've been keeping an eye on you. We have all your information, and you know what happens to whistleblowers." The voice paused. "We'll give you one chance to back out. Delete the files. Walk away. If you don't, we'll make sure your life is over. Your career, your reputation, your freedom, all gone." Emily stared at her phone in disbelief. Was this really happening? Had the pharmaceutical giant found out? That fast? But as she looked around her apartment, a sense of calm washed over her. She had done what she needed to do. No matter the consequences, the truth had to come out. She wasn't going to back down. The next day, the news broke. The story she had risked everything for hit every major outlet. Emily's heart skipped a beat when she saw the headlines. "Whistleblower exposes Big Pharma's deadly drug testing scandal." It was happening. The world would now know the truth. And as Emily read the story, she couldn't help but wonder, would she ever be safe again? Or had she just signed her own death warrant? The backlash was immediate and overwhelming. Emily had expected some noise, but the sheer scale of it was dizzying. Reports came in from across the globe. Pharmaceutical watchdogs, government agencies, and health organizations were all calling for investigations into the allegations. The pharmaceutical giant, now under intense scrutiny, denied everything. They called the claims unfounded and labeled the hacker behind the leak as a disgruntled employee trying to destroy their reputation. But the evidence was irrefutable. Whistleblowers from within the company started coming forward, corroborating Emily's findings. They described horrific conditions in the laboratories where vulnerable test subjects were coerced into participating in dangerous and unethical drug trials. Some of them were children, some were homeless. Others had been prisoners. All of them were treated as little more than commodities, their suffering ignored in the name of profit. Emily's phone never stopped buzzing. Friends, colleagues, and even distant acquaintances reached out, all asking the same thing. "Are you okay? Do you need help?" She could barely breathe, each message feeling like another reminder of the peril she was in. She couldn't stay in the same place. She couldn't trust anyone. So she packed up her things and left. The hacker known as Vox had to vanish, and she knew the risks of being found. But even as she drove through the night, Emily couldn't escape the gnawing feeling in her gut. There was a new danger now, a danger far worse than the company's retaliation. The lives that had been destroyed by this system, the people who had suffered, they had names, faces, and stories. How many more had to be harmed before justice was served? As the weeks passed, Emily stayed hidden. She used burner phones, encrypted her communications, and switched locations often. The media storm surrounding the scandal only grew more intense, but with each passing day, her sense of unease grew stronger. It was as if the eyes of the world were now on her, and she couldn't shake the feeling that the pharmaceutical giant wasn't the only force hunting her down. And then, one morning, Emily received a cryptic message from an anonymous source. It was a list of names, people who had been part of the drug trials. Some were still alive, others had died. The list had been carefully compiled by someone who knew the dark depths of the company's operations. At the top of the list was a name that sent a shiver down Emily's spine: Dr. Ian Cartwright, the chief of clinical trials at the pharmaceutical company. Emily's hands trembled as she scrolled through the document. There, in black and white, was proof of everything she had suspected but could never fully prove. People who had been sacrificed in the name of corporate greed. These weren't just random test subjects. These were people with families, with lives that had been stolen from them. The message contained one last sentence: "The files are only the beginning. You have to expose Cartwright. He's the key to everything." Emily's mind raced. This was the chance she had been waiting for, the key to unraveling the entire operation. But going after Cartwright meant going after the heart of the company, and that would put her directly in the crosshairs of an enemy far more powerful than she had ever imagined. Cartwright was a well-known figure in the pharmaceutical world, a man whose influence reached the highest echelons of government and business. But Emily had already gone too far to turn back now. She had exposed the company's dirty secrets, and now the man responsible for it all needed to be held accountable. With the weight of the world on her shoulders, Emily set her plan into motion. She reached out to a trusted investigative journalist she had been in contact with during the leak. They had exchanged encrypted emails, their communications brief and calculated. The journalist's team would help expose Dr. Cartwright's involvement in the trials, but they needed something undeniable. Something that would prove beyond a shadow of a doubt that Cartwright was complicit in these atrocities. It wasn't just about taking down a corrupt doctor. It was about taking down an entire system, a corporate juggernaut that profited from human suffering. If she succeeded, the fallout would be global, and Emily knew that no one, not even the government, would be able to protect the company from the consequences. It was late one evening when Emily received the breakthrough she'd been waiting for. The journalist's team had gotten their hands on an internal email thread between Dr. Cartwright and the company's CEO, discussing ways to cover up the drug trial fatalities. In the emails, they discussed falsifying test results, bribing government officials to overlook safety violations, and even pressuring the families of the deceased to keep quiet. Emily's heart raced as she read the damning messages. It was everything she had hoped for, and more. These emails didn't just implicate Cartwright. They tied the company's highest leadership to the cover-up. But now came the hardest part. How could she get this information into the public domain without risking everything? Emily spent the next few days carefully planning her next move. She couldn't trust anyone. The journalist was good, but she couldn't risk it. She had to be the one to expose the final piece of the puzzle herself. She prepared a set of documents, including the emails, hospital records, and evidence of bribery. She placed everything on an encrypted drive and sent it to multiple global news outlets, each one with a brief message. The truth cannot remain hidden any longer. As the days passed, Emily watched from the shadows as the story gained momentum. Cartwright was being scrutinized. The CEO was called in for questioning, but the pressure was mounting, and Emily knew the company would fight back with everything they had. This wasn't just a corporate scandal. This was a full-scale war for survival. The global response was swift. Countries around the world began halting imports of the company's drugs. Lawsuits were filed. The company's stock plummeted. Cartwright was arrested, and the CEO was forced to resign. But Emily knew this was just the beginning. Exposing the truth had torn the veil off an entire industry that had profited from the exploitation of the vulnerable. As the dust began to settle, Emily realized one undeniable truth. She had changed the world. The cost of her actions had been immense. She was now a wanted fugitive, constantly looking over her shoulder, never able to return to the life she once knew. But she had no regrets. The battle was far from over, and the fight for justice would continue. But Emily had ignited a spark, a flame that could not be extinguished.